have Abby Russell here today from Marsh, which we are super happy about. The number one thing we were asked about on our survey for what the council wanted to hear was employee mental health. So Abby's going to be bringing that to us today, which is very exciting. If you have questions, I'm sure she'd be willing to answer them at the end. So without further ado, please enjoy Abby Russell.
Thanks, Jenna. Well, good afternoon.
Everyone.
Yes, everyone. A crowded room. I love it. As Jenna mentioned, I'm Abby Russell. I am a health management consultant with Marsh McLennan Agency and have been doing this type of work for almost 20 years now, which is hard to believe. And really love that the members here have requested the topic on mental health. As I'm sure you guys all know, it is a hot topic across the country, but it kind of always has been. And I think one of the unique things, and particularly being able to have the opportunity to talk to an HR counsel, is things have changed a lot, right? Is HR used to be all about employee relations, and that's a lot of what your focus has been on. And now each of you, I'm sure, are pulled in a myriad of directions and areas you're trying to focus on, in addition to managing employee relations. And so I think the main message and a lot of what we'll talk about is it's going to take a community to support mental health. And in the workplace especially, it's a challenge. And it's just become more and more complicated with remote working, multi-location, to the influx of social media and other aspects of our lives. So today, I just wanted to touch a little bit on understanding the current landscape, which I'm sure many of you guys are very well aware, so we may jump through it pretty quickly. And then some of those common barriers, again, I think a lot will resonate with you guys, and we'll do a little quiz just to keep things lively. And then I'll talk more on action in the workplace and really what can you guys be doing. And so we'll spend a little more time there. And at the end, I always am a big fan of a call to action, so I am going to ask for a commitment from everyone. Jenna said save questions for the last. Feel free to interrupt me. That doesn't bother me at all. I welcome questions throughout. We can go off topic. I think we have 20 minutes, right? Give or take. So yeah. So it's not a big deck at all. So we'll jump into it. So I think, spacebar, she said, just looking at current landscape right now, I think these are some staggering numbers, in my opinion. When you look at the percentages, almost all are over 50%, so if that tells you anything. But $1 trillion is what mental health is costing us in the economy, from basically depression and anxiety, and what that's doing in the workplace for the working days. That impact on the economy is $1 trillion. And that is globally. That's not just the U.S., that's globally. When we look at the U.S., you see lost productivity due to mental health issues is costing over $47.6 billion. And I know you guys know, right, where that lost productivity is coming in and the different ways we're calculating it. But I think, as you can probably guess, it's probably understated, right, in terms of how we're actually capturing and statistically figuring lost productivity. It's not the absenteeism and where you're looking at, it is the absenteeism, it's not looking at presenteeism. How do we calculate and figure presenteeism when somebody is just looking at their desk and pretending to work and aren't really working? So 48% reported a decline in mental well-being in 2022. 60% felt emotionally detached. I think when we talk about 2022 and all of us, we're always pre-COVID, post-COVID, and what that impact is. And we've definitely seen a huge decline in mental well-being post-COVID. That has been a really significant event in most individuals' lives in terms of how they're managing that. And even we're still learning the symptoms and the aftermath of actually being diagnosed with COVID and what that people are dealing with emotionally. One of the biggest symptoms of COVID was insomnia and lack of sleep, and what that does to our mental health as well as just general health. So when you start to attach that to the mental health discussion, it definitely is impactful. So that 800%, love that number, 800% ROI when you focus on workplace mental health resources, right? So, and that's again being measured through productivity, lower turnover, so those retention efforts, and looking at absenteeism and all of that. 77% of workers reported experiencing work-related stress in the last month. That's over 3/4 of your population, right? So how are we managing that? How are we looking at that from the human resources lens from what you guys are doing? But then also, as I mentioned, it's a community effort of your workplace, community effort of our environment, our social side. So how are we supporting each other, and how are we managing that? And then the last statistic in the US, 84% of employees faced at least one mental health challenge in the past year, and 76 reported symptoms. How many in the room have had a mental health challenge in their opinion in the last year? Yeah. It's and I think too that the definition, right, of a mental health challenge is also broadened in terms of our understanding and our appreciation for what really is that challenge. And if you have been to the doctor recently in the last 3 or 4 years, most people are doing depression, suicide risk, PHQ-9s and things like that, where they're asking about, did you move? Did you have a death in the family or a death of a friend? Have you lost a job or had a workplace change? Things like that. All of those stressors create a mental health strife in your life. And that was a mistake rhyme, sorry. But I think that's the other thing that I really look at when we talk about mental health in the workplace is, I look around the room, most of you probably came in the same generation where I did, where you leave your life drama, your home, leave it at the door, right? How many times did you have a manager when you first entered the workforce that said, you need to leave that at the door, come into work and don't bring that baggage in? And I think that's changed a lot, in my opinion.
You know, it's funny that you mention that, because I was going to go back to your stat regarding previous, 48%,
Mm-hmm.
and COVID. I just wonder, right? Does that number have anything to also do with during COVID we were at home, right?
Yeah. Mm-hmm.
And so to your point where leave your concerns at home, well, people are working at home.
Yes.
So now they're actually faced with those issues while they're working, right?
Yes.
I don't know, I just wonder.
In addition to that, I was just actually wondering, because we are 5 years plus
Yep.
COVID, so there are much younger people in the workplace that in that 5 years. So is part of that generationally where they're more accepting and more willing to talk about it?
100%, Scott. I think, and Sean's nodding his head, and I overheard, I think, a conversation where he spoke to this group several months ago, earlier in the year, on the generational aspects of the workforce and how we communicate to them, how we work alongside each other as with 5 generations in the workplace, basically. That Gen Z, Gen A group really is more vocal, more open about their mental health concerns. That whole idea of leaving your baggage at the door has pretty much been removed for those generations. And I think for Gen Xers and the baby boomers, it's still a struggle to have those conversations in the workplace. And we'll go ahead and jump to that slide. We'll jump around a little bit.
Abby, as we're talking with our clients about plan changes, plan enhancements, one of the primary areas that everybody is investigating, if not implementing, is surrounding behavioral health.
Yes.
More access,
Yes.
different avenues, no longer relying on the health plan itself, but looking at specialty point solution vendors to provide that support.
Yep,
So
exactly, Sean.
it's-
Thank you. Yeah, and that again goes back to the community effort idea is we're going to have to tackle mental health from so many different directions and aspects to really make sure we're reaching people where they are. I look at this statistic to what Scott, and sorry I didn't get to meet everyone's names. I caught a couple names as they walked in, but 57% of employees felt more comfortable talking to coworkers about their mental health after receiving training about mental health or available resources. And these are polls, so the sources are in here. If you wanted, we'll get this deck out to you guys. Jenna told me we can get it out. But this is from NAMI, the Workplace Mental Health Poll, both 24 and 25. So recent data and statistics where we'll talk about mental health training. If you're not familiar, there is mental health first aid training that's available, and I highly recommend it. It's something I talk to my clients about all the time, of offering that training to your workforce. And if you could afford to offer it to your entire workforce, I 100% encourage that. But at a minimum, making sure your human resources teams are trained, your safety teams, and then ideally, if you can, managers. And just that statistic, the fact that after receiving training, 57% felt more comfortable, really spoke volumes to me. And then I think the second one is the point that 45% of managers don't know how to access mental health care services, and 22% didn't even know it was offered. How much does that just kill your soul as HR directors to hear that you have employees that don't recognize they have resources at their fingertips, especially mental health resources? I feel like it's like saying that you don't have medical benefits, right? But that's the reality. Is we really look at any benefits, as Sean mentioned, what we are offering our employees, the members of our organizations, is we offer a lot. I mean, in the United States, the benefits that are offered to our employees are numerous. And the sad thing is, though, is a lot of people don't realize what they have available to them. So a lot of what we'll talk about is that communication and awareness. But in that bubble, however, 42% of employees worry their career would be negatively impacted if they talked about mental health concerns at the workplace. Probably not surprising to any of you to hear that statement, is it?
Surprises that low.
Yeah, true. And I truly believe, to Scott's point, this is 25 and 24 data. I think a lot of that is the newer generations coming in. I think it is the steps we've made as a community, as a workforce, to try to break that barrier. So I said that word, barrier. So from a workplace perspective, just brought up some of the common barriers for addressing mental health, accessing mental health. What are those concerns? And on the far right, you really see what, and again, I don't know many of you in the room in terms of what your organizations are like, but I think everyone's still dealing with excessive workloads, long hours. In our day and age right now, there's, and remote work, working from home, we don't draw distinct lines anymore. When we talk about employees from 25, 30 years ago that punched a clock and went in at 7 o'clock, 7:30, 8 o'clock, and then they punched out. They weren't bringing laptops home. They weren't bringing phones home. You really were able to have those distinct lines, and overtime was not as big as it is now. So then you have those work-related stressors, and there's so much more than those obvious. And the unclear roles is a big one that I think, as human resource team members, that's something you guys can really help your teams with, your managers, your department leads with, is how do we help define someone's role so that removes those stressors of, I don't know what I'm doing in my day, and I'm getting someone asking me to do X, and is that a part of my role or not? And do I have the permission to say no, or to say, hey, let's evaluate whether I'm the right person to do this? And then cost of services, obviously a big one that I think is getting better. We're working more. A lot of people now have telemedicine benefits that include behavioral health, mental health resources, and thanks to the newest bill with HSA plans and being on high deductible health plan, you can make telemedicine $0 copay. So you have that opportunity to open that up if you so choose as an employer, to open that telemedicine at $0. And then I touched on this with the lack of awareness and understanding with those members that said they didn't even know they have a benefit, right? And that's one of the biggest barriers, is if you don't even know you have it, you're not going to look for it. And then we touched on some of those statistics around fear of discrimination, unsupportive culture, confidentiality, are all huge, just common barriers in the workplace that I think ultimately, as I work with clients and I'm looking at this, is how do we check each of these off and make sure that we've addressed these barriers and we're removing those barriers to have an impact? All right, pop quiz time. I'm not going to give you the answers first. We're going to walk through the questions. Do you believe, true or false, 1 in 10 people experience mental health problems in the workplace? Raise your hand if it's true. 1 in 10.
Was it 75%?
Okay.
You give us the answer.
I hear more than that, so I have a couple falses, and so we have mixed answers. Okay. Second question: well-being initiatives can reduce healthcare costs by 25% over 5 years and improve employee retention and satisfaction. True or false? Trues, raise your hand. Oh, unanimous. Okay. All right. Third, depression can affect anyone for no reasons that can be easily identified and regardless of their socioeconomic status. True or false?
True.
Excellent, unanimous. You only need to take care of your mental health if you have a mental health condition.
Oh, that's true.
Denise is the first. All right. Okay, let's run through the answers. So what's the reality? Sean, I think you saw my notes beforehand. I heard that 75%. That was from SHRM earlier this year. So 75% of U.S. workers say they have experienced at least one mental health challenge in the past year, right? And yes, the unanimous agreement, well-being initiatives have proven to reduce healthcare costs by 25% over 5 years. And to me, I mean, I would say that's probably understated, but 25% is still a great improvement, a great jump. So is it worth it? Yes. And depression does affect anyone for no reasons that can easily be identified and regardless of their socioeconomic status.
Or have they connected the dots between health plan costs and workers' comp costs? Are they correlated?
There are some, and you know this well in our own environment. MMA, Marsh has our own data analytics system that we use to look at data and pull in claims data from the medical plans, but we're also pulling in your workers' comp data, we're pulling in disability data, and that's fairly new still, and a lot of it is dependent on the fact that do we have clients that have both their insurances with us. But there are studies that are occurring as they're getting that data, but it's tough from a Department of Labor perspective and medical where everyone's collaborating and getting that information. I would say 100%. There's definitely a correlation you can find if you look at safety, OSHA studies, things like that someone's mental health is, if it's well and improved, that they're less likely to have injuries in the workplace. So there's definitely statistics in that regard. So great point, Sean, in terms of taking that other avenue. And it's something I spend a lot of time with our clients on is where's the opportunity to tie safety into promoting wellness in the workplace. A lot of times if I'm not finding a budget with my client for health and well-being promotions and opportunities, I'm saying, do you have a safety team? Do you have a safety director? What do you have that how else can we get this into the GL to make some headway on supporting mental health and well-being in the workplace? And so, yes, great point in terms of ways that you can also tackle this.
So with the kind of most of what you're talking about so far is like in your program.
Correct.
So I know we're battling the rising costs every year. We're budgeting for 20% increase in healthcare costs. Is that correlated to whether or not the mental health is in your plan? Do you see are the affordable plans including good mental health benefits, or is that something where they're getting something we need to pay attention to when we're selecting a plan?
It's a great question, Denise, and I think that it's a multifaceted response, and in regards to, yes, your medical plans definitely have good mental health, behavioral health coverage and resources. The catch is that many of you are hearing is when you look at your local networks and what the healthcare systems are offering from a network benefit, is it's a capacity issue, and they don't have the capacity to take on the patients and the members that need help, which is why we really are seeing an influx of EAPs, an influx of more specified mental health, behavioral health vendors popping up. I'm sure I'll say names that we've probably all heard of in terms of Lyra and Spring Health and Calm and BetterHelp that are all coming out there, and they're combining and getting, just like the primary care telemedicine world is why we're seeing it on the mental health side and behavioral health side, as well as how do we make it more available and allow it? And you're seeing a lot more telemedicine. In fact, I've been shocked as I've gotten more into the data, how much of behavioral health, even through the medical plan, is telemedicine. Most of the time we see it as over 50%. And it's truly your therapist, your licensed therapist, your psychologist in psychiatry taking that too, because it can be, they don't need to put their hands on someone, right, to treat and care for them, so they can move it to telemedicine and see more patients in a day than to try to wait and have people be late and they've come in 5 minutes late and it's backing everything up. So a lot of them have moved to telemedicine. So long answer is yes, I think your medical plan is offering the benefits, but again, do they have capacity? Most you're seeing is it's a 3-month wait to get in to see a psychiatrist or a licensed clinical social worker or a licensed therapist. And that's something else too, is understanding. And one thing we put out a communication to our clients and have is a know where to go on mental health, and even defining what is licensed clinical social worker, what's a psychiatrist, what's a licensed therapist, so that they understand their levels and who are you gaining access to and what can they help you with. Can they prescribe if you need prescriptions, things like that. So I think the trend in a nutshell is that more people are adding additional mental health resources on top of the medical plan. So jumping into how do we break down those barriers? And we talked about, right, the workplace barriers in terms of what's happening with the workplace stressors, the work overload, all of that, to what's that culture, confidentiality. So fostering a respectful and inclusive environment. And you'll see some redundancy as we talk through some of these recommendations and actions that you can take. And a lot of this is, I realize it's easy to put these into words and say, hey, roll this out. Then what really is happening when you walk back into the workplace and you're talking to your executive leadership team or you're talking to your board. So I encourage you, and I was just on a call this morning with a group that had a myriad of ideas of things that they wanted to do. And it's like, okay, like low hanging fruit, let's prioritize. What do you feel is going to be low cost? What are the easier things to tackle, and start with the little things. I emphasize the environment and the culture. I really feel like anything you can do to make steps towards improving that environment and culture in your workplace, where people feel safe, where people feel that it's okay to talk about mental health and get the help that they need. I think that's one of the biggest things that's going to help you in the long run of making sure that there's less crises, that they are, retention from the standpoint of they feel like this is a good place to be and a good place to work. So, and there's an overlap here too as well with policies and respecting boundaries and things like that. But as much as you can, allow people, and again, encourage it for those that work from home, is we have those settings in our Outlook. Most of us are using Microsoft Outlook, but even if you're using Google or whatever else, you have the ability to write your emails at 9 o'clock at night. And if you're one that does that, but delay when they arrive in the recipient's inbox, right? Where you can set it to arrive at 8 or 9 a.m., whatever your work policy is. And it's even more difficult as we have global populations or across time zones, and somebody else is working at 9 o'clock on the Western coast and you're over here trying to support them. We have a client that's based out of Utah, and she's holding office hours until 7 o'clock at night during open enrollment. And I'm just like, holy smokes. But the point, as you guys know, it's that time frame. And so how is she taking care of her own mental health and conveying that to her team? And so I was talking to her about being open about how you're supporting this and you're supporting them, but then how are you turning around and taking care of yourself? And I think that's one of the big things I talk about from a leadership perspective, whether it's you and your team, but also going back to your managers and your leaders, is asking them to truly emulate and model good mental health. It's so important to use your out of office, encourage people to explain that they're taking vacation, that they're taking a mental health day, make it okay to share and convey that we all need to, right? One of the statistics is we all need to take care of our mental health, so that you're taking that time. But I think so many, and I've been guilty of it too, is you feel guilty saying you're on PTO. You don't want people to know that you're not available. In our role with Marsh, Annie, I know as a salesperson can represent this, is you don't want someone to think you're not available, but it's okay to put that in your message. I'm taking time for myself, but if you need me, reach me on my cell phone, but you're also communicating that I'm taking time for myself. So I'll jump to that side. So, and I'm not going to harp on intermittent leave. I know that's a hot topic for most, but looking at your leave policies and what can you do? How can you be more inclusive with that? You're always going to have the bad apple that I know it's going to ruin things, but for those that really do need it, finding ways to support that. The mental health days, anti-stigma campaigns, pledges. There's a lot out there that you as an employer can take on, from pledging to be, mental health friendly, to supporting, to, reducing that stigma. And there's different templates that are out there that you can find to support your organization in making those statements. Quiet zones and relaxation areas. This kind of, again, bridges between environment and a policy or a benefit. And this is the first time I've been in this building on the MMA floor, because we actually work in a different office. They have a wellness room or a relaxation room. I forget now which it was called. But most people are doing that and having that quiet area or that relaxation area where they really can. And I hate to say it, but it's okay even if it's just to go shut your eyes for 10 minutes, and put an alarm on, but you're not at your desk with your eyes shut and everyone's like, that person sleeps all day. Giving them that area, that opportunity to take that rest break and have that minute. And it's even huge. We have a couple clients that have put it in the manufacturing environment, where if somebody really needs to take that, my manufacturing clients have loved that, because what does it do in turn if someone really just needs 10 minutes? They have a migraine, they have a headache, they need 10 minutes. What's happening when they take that, go to the relaxation room, and they're back on the floor in 10 minutes? What's the alternative? They're more productive, because most of the time, if they have a headache or a migraine and they've got to get off the floor, they're walking out taking a sick day, or they're walking out taking a half day or a whole day. Now you've just kept somebody at work, made them more productive than the alternative. So looking at different ways in your environments that you can provide that resource. Again, you're creating that environment where, hey, we're accepting of your needs, and we're going to provide these resources for you, and you're in turn benefiting the productivity of your organization. Assessing the needs, and I know surveys, feedback is always a tough one, and a lot of times we feel over-surveyed, we get survey fatigue, and so I recognize that and appreciate that. But if it's, let's say you're doing a best places to work survey, is, what ways can you incorporate a question or other things into a survey so that you're not creating survey fatigue, but you're still getting that feedback of saying, and I will always say one of the best benefits of surveys is it raises awareness. When you do a survey and you're just asking, did you know that we have XYZ resource? That, even if they're checking no, they know now. They know that you have that resource because they've just seen and answered that question. So looking at that opportunity to assess the needs of your organization, but then also to raise that awareness, see what resonates, what do they need. Mentorships and peer role model programs, anything like that can be extremely helpful in this state of supporting mental health, providing people the resources that they need. And if you have those mentorship programs or peer role models, mental health first aid training for those groups as well. So if they're a manager or they're a leader, but they're also maybe a mentor, getting on that mental health first aid training can be huge. So keeping those in mind, even your ERGs, if you've got leaders in an ERG, looking at those opportunities. So regular trainings, some of these are things that you hear all the time, right? Team building, conflict resolution, mediation. Those are all going to be positive trainings that are going to support your team members with mental health concerns, and give them some of the tools and resources they need to help improve mental health in the workplace and as well as at home. How many are familiar with mental health first aid training? Okay, good, Annie. Thank you for raising your hand. Mental health first aid training is actually a national initiative. A lot of different organizations are embracing it and offering it. We have our organization has several trainers. I am not trained, but I've done it 3 times. I did my first training probably about 15 years ago. It was a community-based training. And I think for a lot of people, it's a little daunting because it's just like CPR is what I equate it to. Is I think a lot of people were afraid to get trained in CPR because it meant they had to act, right? And so I think with mental health first aid training, there was a little bit of a stigma behind mental health first aid training that then it meant like, oh, so when I see somebody and I think that they're in crisis, I'm supposed to jump in and act. And that's not the intent behind mental health first aid training. It certainly can help, but at the very least, it's helping your team become more aware of what's going on around them, realizing I always think when I hear mental health first aid training and after doing them, how many have seen that Cleveland Clinic video about the hospital system and you see people walking through and it has little bubbles of what's going on in their life and basically saying that you don't know what's going on in someone else's day and impacting them. Mental health first aid training really is about recognizing and how to address and or communicate with someone and just realizing that they may be going through trouble and helping you understand that maybe some of the things you've gone through too as well and how to respond to that. It's an 8-hour course. It's typically split up into 2 half days. So most of the time when you see them, they try to break it up. And 2 half days is probably the most effective and advantageous to the recipient of the training. But it is a big time commitment, right, from a workplace perspective to pull people away for a total of 8 hours. But I really do feel like can be done virtually. It can be done in person and virtually. I do feel like for leadership, management, when you look at safety teams, and again, I talked about mentorships, peer role model groups, things like that, having that training and just really being able to help understand what someone's going through, and then how to get them to the help that they need, whether that's calling a therapist, whether it's calling 988, a crisis line, really is helpful. And so again, the team building activities, ERGs, peer support networks, this really touches to me on the environment side of things in terms of that the community aspect and what we're doing. Again, our workplaces have changed so much, right? How many of you have social hours, things that you're doing in your workplaces? You're having these, it's what we're asking for now as employees. We're spending so much time at work. We want a best friend at work. If you've done a Gallup survey, right, one of the biggest things is having a best friend at work, someone you can confide in, someone you spend your day with. We spend the majority of our time at work. And so how do we really create that safe environment in a place where people feel like they have support and they have that social connection? So at the organizational level, really kind of recap is fostering that supportive culture. So those steps I shared before, but creating that collaborative environment, that social community is really important. And that's independent and unique for each organization. You're going to find what works for your group, and hate to say it, but that's where surveys come in handy too, is what's going to resonate with the groups and what can you do. Ensure easy access to resources. I think communication is huge, right? And we probably, unfortunately, don't do enough. I encourage a monthly communication about mental health EAP resources. I am guilty of this, and I've had to go looking for things, but you might see it at open enrollment and know you have a benefit, but when you're in crisis or when you're in need, are you running back to your benefit guide to say, oh, I think I have, where do I have? I mean, you're probably calling a friend. You're probably going to a coworker if you're comfortable going to a coworker, or they're coming to you in human resources, or they're just struggling and they're on their own. and they end up in the emergency room, or they end up just handling it at home. And so keeping that on the forefront, making sure it's visible, and bulletin boards, I think, are making a comeback, but having intranet sites, things like that, where it's regularly posted and available, that here's the resources that are available to you, and making sure that they understand, because again, we don't know that we need it until we need it. Well-being programs, so mental wellness, so mindfulness, stress management. I think you asked about what resources are available through your medical plan. Most medical plans also do have a well-being resource, right? And a lot of those well-being resources have stress management, mindfulness techniques, different things that they can be doing to help manage that mental health in their bodies. And so I think looking at well-being and your physical well-being is really going to make a difference in your mental health as well. I'm sure you guys have all heard that. If you're exercising, you help manage your stress, and that's going to help manage your mental health as well. So promoting those other resources that are available can really help mental health as well, and give them the tools and resources they need for self-management. And then on a personal level, really, I want to touch on what we as individuals can do. And I touched on this earlier in terms of the publicly taking breaks, going to lunch, trying not to get caught eating at your desk and working too much, taking that time and encouraging, and it's so much about how you respond to things, what you say to people. But that's so important, to take those breaks in your day and take that time. And so it's important to emulate that. The self-care strategies, I had a client, Sean knows this client, her out of office their organization was actually doing a team building, and they were doing a build with Habitat for Humanity. And so she put it on her out of office, and she was an HR director, it's April. And she had said, my team's out doing a Habitat for Humanity build, and then I'm taking the rest of the day to rest and recover, and I'm getting a massage, and then I will be hydrating. And I was like, okay, girl. But it really, it resonated in me that she was communicating that, one, they're doing something as an organization, this team building. Then she was taking time to take care of herself following that. Denise, I see your face. She's like, I would never put that online.
An organization also during Mental Health Awareness Month, probably because they know Friday afternoons are not very productive anyway, but they did recognize it and told everybody, check out from lunchtime on this year mental health break as an organization.
We did.
So just to reinforce that that's part of our culture.
Yes.
And it kind of ties us to thinking outside that.
Yeah, I love that. Thank you for sharing that. Yeah, we did.
Every Friday?
No,
Just one. And it was half. It was half.
it was a half a Friday on World Mental Health Day.
Yeah.
And then you've got Mental Health Week, which is something else we'll talk about too, is in May. And that's something where, again, I wish we could do it every month, right? To just raise awareness and provide those resources. But it is a good time to the benefit of embracing World Mental Health Day or World Mental Health Week is you're going to have a lot of tools and resources at your fingertips to help you promote it at that time. And then professional development and growth, right up y'all's alley in terms of just looking at those opportunities. But the open conversations and active listening, and I think that's something we often forget, is to really take that time to listen. And that's something else you hear a lot in mental health first aid is listening and making sure that you're hearing what someone's saying and responding to that effectively. So 988 is the suicide and crisis line, if you didn't know that. And I think, again, posting things like that, making sure they have the resources they need. But the reality is suicide and crisis rate is major, and not to downplay that. But unfortunately, a lot of what's impacting our workplaces and our bottom line is anxiety and depression and some of the less major things that they really need that support. And a lot of too is dealing with the generational side, is it's different for every generation. It's different for every single employee. So that's where coming in with that culture and that environment where they just need to feel supported and need to feel like they belong, and that they have the help that they need and can get when they need it. Sometimes that alone reduces that anxiety and helps provide that support. So looking at, those ERGs, if you have them, finding ways to look at ways to incorporate mental health into those ERGs, not to say that you need a mental health ERG or a group, but that when you have those, in a popular one is Veterans Group. Yesterday was Veterans Day. A Veterans ERG is making sure that you, as your human resources team, that you're sharing with those ERGs that these are resources we have available. Please share this with your group. Make sure that it's out there. A lot of them have their own internet sites, websites, things like that within your organization. And so using that as another access and communication standpoint to get that out to your other working groups is another easy way to communicate the resources. Questions?
Just to kind of, I guess, step back a little bit. When it concerns the workplace, what encompasses mental health generally? I mean, we've talked about depression and anxiety. Are there other?
So yes, so one, you can get into your major high acuity diagnosis from schizophrenia to bipolar disorder. Those are going to be your more, and you're going to see more and more. You're going to see, we are seeing more and more people in the workforce that are getting the medication that they need to be stable and integrated in our workforce, but that doesn't mean that they're not going to have episodes or that there's things that trigger. Spectrum, individuals on the spectrum would also fall into that. So, and I think the other reality is, to your point with depression and anxiety, is I think many of us growing up probably, had a parent or had a friend that was dealing with depression or anxiety, and it went undiagnosed or it went really untreated. And at the time it was just, toughen up and get out there and do what you need to do. And today is really helping to understand that, we can support that. You don't have to tough it out and ultimately lead to heart, cardiovascular issues, things like that. And I think that's the reality of what we've seen with that generation that's really just toughed it out, is now they've got high blood pressure, high cholesterol, other health issues because they were toughing it out versus learning tools and strategies to help improve the anxiety, the depression. But I think to your point, and then really when you get into more of the crises outside of suicide, is someone's having and the mental health first aid training does talk about schizophrenia and bipolar disorder, and understanding if someone is having an episode, if you will, how to support that and provide that.
They go even like more of a day-to-day, like ADHD and things like that.
Mm-hmm. Yes, absolutely, it would include, yes.
Are there good resources for small businesses? Like, a lot of what you're talking about, it's like, sure, it'd be great if we even had an HR director. So
Yeah.
where do we look?
NAMI is probably the biggest place with a lot of resources. Your broker is another great resource if they have someone like me, which many of them do. We're happy to help if that's something that's up your alley. But NAMI is probably one of the first places, and then they're going to help promote mental health first aid training as well. But now in today's age with Google and things like that and AI, if you have an AI resource or if you have ChatGPT, it's amazing what you can find. And just really with, hey, type the question. I want to get started with a mental health promotion campaign in the workplace. What do you recommend? I think you'll find a lot of resources. And to your point where, it is the comment we made earlier about the safety team, and where else can you look at how do we, incorporate this into the workforce? There's a lot of different avenues, whether it's HR or it's safety or it's the administrative team, but it is important. And same thing right now, I think most offices, probably some of you with smaller, don't have AEDs in the workplace, but a lot do, and a lot have an AED to help support that. And that's new, right? In the last 10, 15 years. how are we trying to protect and prevent major events.
To Denise's point, Buckhead has a lot of small and medium-sized businesses. Is there something the peer support networks? They're not going to, it may be like 5 people in that workplace, and they're not going they basically don't have are there resources separate, within industries or?
Sure, there are, I would say, a couple different avenues in terms of NAMI will have peer support networks, and you guys have a pretty big NAMI presence in Atlanta and several different offices in the greater Atlanta area. And I apologize because I don't live in Atlanta. I serve our Atlanta team, but I live in Greenville, South Carolina, so not as familiar. So if you hear me stuttering with my Atlanta terminology, but that, and also, as I mentioned, some of your other, your medical resources, if you are offering benefits, I don't know if all of you are, but a lot of those will have peer support networks, whether that's, Blue Cross Blue Shield, Anthem, all of those have a personified type of well-being thing. They have peer support groups in there where you just jump in, where you're talking to, other strangers per se. But there are a community where NAMI can connect you on the hospital systems. A lot of your health system networks will have peer support groups, particularly around mental health, that you can reach out to. So looking at those types of resources for getting people engaged or letting them know that it's available in your area, that they can touch. Question? Anything else?
Great, thank you.
Yeah, you're welcome. Well, I do encourage you, as we talked about Mental Health Awareness Week. So my ask and commitment is that maybe it's World Mental Health Day or Mental Health Week, but I hope that you might look at a way that you can do something to look at mental health in your workplace during the week of May 11th, whether it's something you do individually or you pull a group in and bring in a guest speaker, or look at some other opportunities to just promote mental health in the workplace. And Annie and Sean in the back, their information's on here. And if for some reason you want to touch base with me, feel free to email them and they can put you in touch with me too. But thank you for the chance to speak to you. Appreciate it.